Health experts warned us that a so-called tripledemic of COVID-19, flu, and RSV would strain our nation's healthcare system. Now they say it appears we have hit the peak of illnesses this season.
Emma Jerome joins us live in downtown Portland this morning with more on how local hospitals are handling the stress, treating all these viruses with limited staffing. Emma?
Morning, Ken. Emily, doctors say we are in a much better place than we were a few weeks ago. They say that's when the surge and the peak of these winter respiratory viruses hit, and they say that we are better now. However, they say to try and predict the future is impossible and a little bit foolish. I spoke with Dr. Peter Graven. He's a researcher at OHSU. He says it was a harrowing winter. He says we saw RSV levels never before seen. Flu levels were the highest we've seen in years, and COVID is still around. RSV and flu peaked at the beginning of December, and though general COVID infection wasn't as high as it has been in the past, it still added to the burden in hospitals. Dr. Graven says now both RSV and flu are down 50% from their peaks.
What we're seeing in the hospitals is that they just barely were able to survive through the RSV and flu surges with COVID there as well. And then there's a big backlog. We still have short staffing.
Dr. Graven said it's interesting, though, because COVID remains year-long, unlike traditional respiratory viruses, which will see a surge during the winter months. He also said he believes we are turning a corner and the virus seems to be maintaining itself. Coming up in the next 30 minutes, we dig a little deeper. I talked to Dr. Graven about how no means no beds. Live in Portland, Jerome News.
All right, Emma, thank you.